All right, let's talk about a war. Not one fought with tanks or planes, but an invisible war that's happening inside our bodies all the time. It's the war against microorganisms. And today, we're going to explore the incredible arsenal of weapons we've designed to fight on this microbial battlefield. Just imagine that for a second. A simple paper cut, a scrape on your knee, and that could be the end. It's a terrifying thought, right? But this isn't some dystopian fantasy. For almost all of human history, that was just reality. But then things started to change. We discovered penicillin, and suddenly we could fight back. We built this amazing, sophisticated arsenal of drugs that completely changed the game. So let's open the armory and see exactly what we're working with. So what are these weapons? Well, they're called antimicrobiotic agents. And it's pretty simple, really. They have one of two jobs: either kill the microorganisms directly or just stop them in their tracks so they can't grow and multiply. They are our frontline soldiers in this endless battle. Now, you have to understand, a doctor doesn't just pick a drug at random. They're choosing a strategy. And when it comes to fighting microbes, there are really two main game plans. The first strategy is called cidal, which literally means to kill. Think of these drugs as assassins. They go in and eliminate the microbes directly. The other strategy is static, which means to halt. These drugs don't kill. They just stop the microbes from multiplying. They essentially put the infection on pause, giving your own immune system the time it needs to swoop in and clean up the mess. And this difference is absolutely critical. If a patient is immunocompromised, meaning their own immune system is weak, a static drug isn't going to cut it. You need a cidal drug to do the killing for them. So let's talk tactics. Our first major strategy is all about brute force. You see a bacterium like a tiny fortress, and the most direct way to defeat it? You smash the walls. You see, a lot of bacteria are wrapped up in this tough, rigid shell called a cell wall. It's basically their suit of armor. It protects them from everything. But if you can find a way to break that armor, the whole thing just falls apart. And we have some seriously clever ways of doing this. Take Beta-Lactams. That's the family penicillin belongs to. They work by stopping an enzyme that acts like a bricklayer, cementing the pieces of the cell wall together. Without that final step, the wall is weak and full of holes. Then you have vancomycin, which uses a totally different tactic. It stops the chains of bricks from getting any longer in the first place. Two different methods, same result: a fatal weakness in the bacterium's armor. Okay, so what if you can't get through the wall? You pivot, you switch your strategy. The next target is the enemy's internal war machine. Right, if you can't smash down the front gate, you sneak inside and sabotage their production lines. Inside every bacterium, there are these tiny factories called ribosomes. Their whole job is to make proteins, the stuff the microbe needs to live, grow, and make copies of itself. So, if you can shut down those factories, the entire enemy operation grinds to a halt. And to remember which drugs hit which part of the factory, there's a fantastic little mnemonic: by AT30, sell at 50. The drugs in AT, aminoglycosides and tetracyclines, they target the 30S part of the ribosome, and the drugs in cell, streptogramins, erythromycin, and so on, they go after the 50S part. They hit different parts of the machinery, but the effect is the same: production stops. But wait, there is one huge exception here that you have to know. While most of these ribosome-targeting drugs are static, they just halt the factory, one class goes a step further: aminoglycosides. They are the only ones in this group that are actually cidal. They don't just stop the factory, they effectively blow it up. So we've attacked the walls, we've sabotaged the factories, but what if there's still a threat? Well, then you go for the command center. This is the ultimate move. You attack the very blueprints of the enemy, their DNA. Every living thing has a set of instructions that tells it how to build itself and how to operate. If you can scramble those instructions, you stop the enemy from ever being able to make more of itself. The key target for this strategy is an enzyme called DNA gyrase. Now, think about DNA as a supercoiled rope. Before a bacterium can copy that rope to divide, DNA gyrase has to come in and carefully unwind and manage it. If you stop the gyrase, you stop the whole replication process cold. And the drugs that do this are the fluoroquinolones. They work by jamming up DNA gyrase, completely stopping replication in its tracks. And these things are powerful. They're cidal, so they kill the bacteria, and they have a wide spectrum, meaning they work against a whole bunch of different types of bacteria. But here's the twist. All this time, we've been talking about our battle plans, but we've forgotten one critical fact. The enemy fights back.
For every move we make, these microbes are learning, adapting, and launching their own counterattacks.
This is not a static conflict at all. It is a full-blown, dynamic, evolutionary arms race. And the microbes, with their ridiculously fast life cycles, are incredibly good at evolving new defenses to get around our best weapons.
The story of penicillin is the perfect example of this. First, some bacteria evolved a special enzyme that could literally snap penicillin's chemical structure in half, making it useless. So what did we do? Our counterattack was to develop other drugs that protect penicillin from that enzyme. Genius. But then, the bacteria evolved again. Some of them, like MRSA, just changed the very thing penicillin was trying to bind to, so our drugs couldn't even grab on anymore.
And this constant back and forth, this is exactly how we end up with what we call superbugs. Things like MRSA. Its name tells the whole story. Methicillin-resistant Staphylococcus aureus. By altering those binding proteins, it made itself immune to nearly an entire class of our most vital drugs. So how do we fight back now? We pull out a different weapon from the arsenal. The current go-to drug for MRSA is vancomycin. Hey, remember that one? It attacks the cell wall in a completely different way, so it totally bypasses MRSA's main line of defense. And just like that, the arms race continues. Which brings us to the big final question. We develop a new drug, and they evolve a new resistance. It's a constant, relentless cycle. When you look at the whole picture, this unending war against the microbial world, it really makes you wonder, who's